Our takeaway is twofold. The first is that in our hypertrophic cardiomyopathy population, elevations in the laboratory biomarker, high sensitivity troponin, is associated with both risk factors for sudden cardiac death, as well as prior history of potentially lethal arrhythmic events. Just as important as this association was that we found that this finding was only present when we utilized sex-specific cutoffs in high sensitivity troponin interpretation. I'm Dan Burzak, and I'm one of the current cardiology fellows here at Mayo Clinic Rochester. The name of our article, High Sensitivity Troponin T Elevation in Hypertrophic Cardiomyopathy is Associated with Ventricular Arrhythmias, will be appearing in Mayo Clinic Proceedings soon. We reviewed 112 hypertrophic cardiomyopathy patients with prospectively obtained high sensitivity troponin values. In this cohort, elevations in high sensitivity troponin were common. 62% had elevated high sensitivity troponin levels. This biomarker correlated well with known risk factors for sudden cardiac death, including non-sustained ventricular tachycardia and septal thickness. When we stratified patients by having normal versus elevated high sensitivity troponin, patients with the elevated troponin were more likely to have experienced sudden cardiac death-related events, which included implantable cardioverter defibrillator discharge for ventricular arrhythmia, ventricular arrhythmias with hemodynamic instability, or cardiac arrest. We then repeated the analysis without the usual sex-specific cutoffs we use here at Mayo Clinic, where the threshold for women to have an abnormal high sensitivity troponin is lower than men. When we repeated the analysis using the same cutoffs between sexes, we found that the association between troponin and arrhythmic events was no longer present. Sudden cardiac death risk stratification in hypertrophic cardiomyopathy can be difficult. As we take a holistic approach to our patients, these findings show that biomarkers such as high sensitivity troponin, which are not currently utilized with traditional guideline-directed algorithm approaches to risk assessment, are a promising path forward. While further validation needs to be done prior to utilization and routine use in clinical practice, our findings justify the need for these to be looked at closer in a research setting. These findings mean that we are one step closer towards providing an individualized approach to sudden cardiac death risk stratification. This research serves as a stepping stone towards the eventual goal that one day we will be able to reliably prevent sudden cardiac death through the appropriate placement of an implantable cardioverter defibrillator, and also recognize which patients would not benefit from these therapies with high accuracy. Our data correlates elevated high sensitivity troponin levels to a history of arrhythmic events. But the cutoffs for what we consider elevated are the ones previously defined for ischemic heart disease. In reality, the optimal cutoffs to predict sudden cardiac death may not be the same for ischemic heart disease as hypertrophic cardiomyopathy. Defining this threshold will require much larger data sets with prospective enrollment. Nonetheless, our data suggests that this approach will eventually be feasible. But we need to make sure in this pursuit, we do not ignore the sex-specific differences in this patient population, especially when it comes to something as important as sudden cardiac death. Thank you for your interest in this topic. For full details of our study, please see our upcoming manuscript in the March 2023 edition of Mayo Clinic Proceedings. And of course, if there are any questions, don't hesitate to reach out to me via email. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter, More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.